Hello. We would like to thank Dr. William Mansbach for taking his time out to join us here today. Dr. Mansbach is the founder and chief executive officer of Mansbach Health Tools, which supports the BCAT Research Center. He is also the co-author of the award-winning book, Brain Health as You Age, A Practical Guide to Maintenance and Prevention. Dr. Mansbach, welcome.
Thank you, Lynn. It's great to be with you.
Great. Dr. Mansbach, I know earlier this year, the BCAT Research Center launched a national survey to elicit feedback from healthcare providers related to two things: their psychological burden or their levels of stress, as well as their experiences during the COVID-19 pandemic. Can you tell us a little bit about the survey and then share some of the findings?
Happy to. Glad you brought it up. So as I'm sure listeners and you are well aware, this pandemic, which still we are in, just to remind people we are still in this pandemic, has really been really grueling for healthcare providers, for everyone. But I guess I'll confine my comments right now to healthcare providers, and we can expand on that to other groups if you'd like, Lynn. But clearly there was early evidence going back to the spring of 2020 that the psychological burden, or sort of the stress that providers were experiencing, like their patients, like families of patients, was high and mounting. We began to collect data even in the very beginning. In fact, we collected data in May of 2020, again in October of 2020. But in February of 2021, we launched a national survey. We had healthcare providers from all 50 states, and actually from almost all clinical settings, so acute care hospitals to the different post-acute settings. We looked at disciplines from primary care to rehab to pretty much you name it, behavioral health. We also looked at allied areas like activities professionals, geriatric care managers, things of that sort. And I guess what I can start with is that across the board, the psychological burden or stress level was high. Now, we measured something called the M5, which anyone could actually download and use for free on the enrichvisits.com website, or EnrichVisits website. We used that because it's the only validated psychological burden scale that you can do quickly, less than 1 minute, that has good, solid research and that's been peer-reviewed and published. It's a good way of getting an immediate snapshot of how one's doing in terms of stress. So I'll stop there for a minute and let you ask some specific questions about the survey results.
Sure. So, Dr. Mansbach, it sounds like by utilizing that tool, you were able to get a quick snapshot of how the healthcare workers were doing. Did the findings give you any specific trends or patterns that you identified?
They did. So the M5 is a scale from 0 to 10. There's a specific cut score. What I mean by that is that if people have scores of 3 or higher, they're in a category of psychological burden. It's further defined. If you have scores from 3 to 5, you have psychological burden, which places you at risk for depression, anxiety, job burnout, all that over time. That's 3 to 5. Scores of 6, 7, 8 speak to an even higher burden, and scores above that, 8, 9, and 10, for example, it's very high burden and high probability of depression, anxiety, and so forth. So the overall score, if you average what we call the mean value of all providers in all states and all settings, was 5.1. So that kind of inches just north of the sort of lower level category. But remember, low level psychological burden is still significant, still substantial. And pretty much all disciplines clustered around 5.1. Some were even higher than that. But it gives you a pretty good idea that people were really stressed. We even asked people questions about whether or not their stress was higher than when, let's say, right before the COVID-19 pandemic began. And as you would imagine, it was much higher.
It sounds like a lot of the healthcare workers are struggling out there. It sounds like your findings really showed that they're experiencing high stress levels. what can the healthcare industry, what can organizations and employers do to support their workers to really help them through this time?
That's a great question, Linda. We launched this project because, one, we wanted to identify how high the burden was, but ultimately, we wanted to come up with strategies that would help lower that burden. I think for the first time, we're hearing healthcare providers talk about not wanting to do their work anymore. We see more people retiring. We see this in primary care. We see it in behavioral health. We see it in rehab. And in the long-term care industry, organizations, employers are having a great deal of difficulty retaining staff and attracting staff. So we worked on a program. It's called 15 for Me, and it's a program that's appropriate for employees or staff who are working for companies or organizations, particularly in healthcare, although you could really be in any organization. But it's also appropriate for individuals and patients who find themselves really struggling during this pandemic and probably post-pandemic. What's interesting about 15 for Me, and it's empirically validated, to one, lower psychological burden, two, reduce stress, which is measured by M5 scores. But in a practical way, Lynn, it's lowering depression levels and anxiety levels. Program requires a person to devote 15 minutes a day, or at least 5 times a week, to doing one of 2 programs. You can alternate the programs, all evidence-based. There's a cardio program. There's a cognitive program. The cognitive program is particularly unique because it utilizes working memory exercises, very specific exercises that research demonstrates improves mood, lowers burden, but at the same time reduces staff turnover and increases employee retention and job satisfaction. What's also unique about the program is whatever a person chooses, cardio or the cognitive exercises, you do those for about 10 or 12 minutes, but they're followed always by a guided or very direct centered breathing and relaxation exercise. The idea being that you recharge yourself, you can go back to work or back to your life with sort of renewed energy. And just to emphasize, the science is very exciting. So I think we really do have a solution. And I know a lot of people are looking for just that.
It sounds like a great program. You mentioned working memory exercises. Can you talk a little bit about what those are and how those are beneficial? And then where do we find those? How do we find exercises that will meet our needs if we're using this program?
Well, I'll start with the end and then work backwards. So you can find them on a website, our Enrich website. It's www.enrichvisits.com. You can just go right to the store, take a look at those. Working memory exercises as a category, a cognitive category, we've been working at these at our research center for many years. Many providers are familiar with them because they're used with patients quite often. What's interesting about working memory is if you think about how the brain works, Lynn, there's a sort of a foundational level, if you will, cognitive level that we call working memory. That's the ability to devote time and attention to be able to learn some cognitive task or use some cognitive strategy. For most people, it lasts about 30 seconds. You can sustain attention for about 30 seconds before you must bring some cognitive strategy in place. You know, one way to think about it is that if I asked you to memorize a phone number, Lynn, a 10-digit phone number, and I gave you that phone number in 10 seconds, probably, right, about a second a digit, you'd be able to remember it pretty quickly. But if I gave you the phone number and asked you to wait for 30 seconds and then come up with a strategy for remembering it, you wouldn't be able to do it. Well, these exercises help people improve their working memory. And it happens to be the case that when working memory is improved, mood functioning is improved, cognition is improved, and basic activities of daily living are improved. So that's why these very specific evidence-based exercises are part of the 15 for Me program.
Sounds like a really great, these exercises are really targeted, but there's a lot of benefits to doing them. I have another question. You mentioned that this would be ideal for healthcare workers, although anyone could really participate in the program. Would an organization be looking to examine this program for their staff members? Is this something that organizations can also access and share?
Right. In doing the science for 15 for Me, we work with specific organizations. We work with organizations on the West Coast, on the East Coast, with this question in mind. They were concerned with being able to retain their staff. They noticed that staff were burnt out, particularly during the COVID-19 pandemic. The idea was that for an employer, not counting break time, normal break time or meal time, would they devote 15 minutes for staff who, let's say, had high M5 scores? And the return on investment for that, if you think about it from a business standpoint, is would they be able to improve retention, improve job satisfaction, improve psychological health? So the trade-off is a very good one. It may be difficult for some employers to think, well, gee, I really don't want to give a staff member 15 minutes, but you get a lot more back. So yes, there is definitely a great interest in a program like this, because there just aren't a lot of evidence-based or scientific programs that can accomplish the same thing.
Excellent. It sounds like this program is currently being piloted, or there are some organizations that you're partnering with at this time. Can you tell us a little bit about when you'll be able to make this commercially available and when folks can start to look for this program for their own organizations or teams?
Like any program that comes out of the BCAT Research Center, it requires a lot of science first, right? It's important that our programs are validated by science, not just based on science. So we have a target date of mid-July to make these programs available for organizations or for any individual who is interested in them. Again, they can go to the enrichvisits.com website. They can look at what will be a banner. Around the banner, it'll say 15 for Me. You can click on that, you get lots of information. We're going to make it really simple for people. They're going to get a manual. They're going to be walked through it. The idea is that whatever your job is, if you're using it for job, satisfaction or retention, or whatever walk of life you come from, the universal condition is that stress is on the rise in this country. And frankly, it's been this way for several years, even before the pandemic. COVID-19 just boosted this, in a very incremental way.
Right. Yeah, I definitely think there are lots of folks out there who could take advantage of a stress management program. So it's exciting to hear that this will be coming soon and that people will be able to make it part of their organization and or personal lifestyle change. So that's excellent. Anything else about?
Yeah, I'll tell you one other thing that anecdotally is that exercises are also fun. So, the physical exercises, the cardio exercises don't require you to buy expensive equipment. You don't have to, if you do it from work, you don't have to take a shower before you go back to work. The science is really clear. So we give people suggestions about how they can do it, what they can do. Sometimes people do it as groups. So it's more fun. There's more meaningful engagement. The biggest feedback we've gotten, though, are from the cognitive exercises, because for people who like cognitive games and things like that, these actually are based on science, but they're a lot of fun. I think we all know that when we enjoy doing an activity, we're more likely to keep doing that activity. And we really were guided by that principle when we created this particular program.
And it sounds like it's all packaged up for the user. So it's very simple to obtain and just kind of grab it and start to use it. And there's not a lot of work required. So that'll be very attractive to a lot of folks because people really want that programming and they don't want to have to search around and find the pieces. It sounds like you've put that all together for us.
Well, when we had a focus group, we asked people what they were really looking for. This does not mean that seeing, getting psychiatric medication or seeing a psychologist or a therapist. I mean, all those things are great to do. Sometimes they're not enough. Sometimes people don't want to do that. Sometimes people want to be self-actualized. They want to do their own self-directed program. For any of those folks, this might be a solution for them.
Great. Well, I hope all of our listeners who joined us today were able to get some new information about 15 for Me and all of the benefits that this program will offer. And we encourage everyone to stay in touch with the BCAT for more updates and information as more is available on the program.
Thank you, Lynn. Great to see you again.
Thanks. Thank you, Dr. Mansbach, for taking the time to join. We really appreciate all the information you shared today.
Sure.
Thank
Bye
you,
now.
everyone, for taking your time to join us as well. We look forward to having you join us on upcoming Facebook Lives. Thank you.
Bye.